Okay, we've thoroughly covered both preparing and disposing of your syringe and needle, but we kind of skipped the injection part, so let's talk about that. When giving injections, you will likely be drawing fluid from a vial or bag or a tube. If you are piercing through a rubber stopper, make sure you go through the center of the stopper and ensure the stopper is clean. For most substances and routes of injection, it's recommended to wipe the top with alcohol before piercing it. It may be necessary to hold the vial or bag while piercing it with the needle. Try to avoid this if possible, but if it's unavoidable, use extreme caution not to poke yourself. Always know the properties of what you're injecting. Some substances can be irritating or even toxic on the surface of the skin. Make sure you're wearing appropriate PPE for the compounds you are working with. If you are drawing from a closed container, some people prefer to pull room air in the equivalent of whatever they may draw up, inject the air into the vial, and then draw out the substance into your syringe. This can make it easier to withdraw the correct amount without creating a vacuum inside your vial. Gravity is your friend. When drawing from closed vials, it's usually easier to tip them upside down to get easier access to the fluid inside. Draw back on the plunger to pull the solution into the barrel of the syringe. Make sure the needle isn't above the fluid line inside your vial, or you will just get air back. Most of the time, you'll want to draw in a bit more than you actually need at first, and then push the extra back into your vial. Do not pull the needle back out of the rubber stopper though. Passing through the rubber more often than necessary makes your needle dull. As you draw up the liquid, you may get some air bubbles inside your syringe. It's critical that you have no air bubbles in the syringe when you inject for a couple of reasons. First, the air will alter the perceived volume, so you will actually not be giving as much as you intend to give. Second, even small air bubbles can be painful and even fatal if injected by certain routes. But clearing out those bubbles can be a bit tricky. Again, use gravity to help. Hold the syringe with the needle pointing upward and get that bubble to float toward the hub of the needle. Hopefully this will happen naturally, but you may need to gently flick the syringe. As tempting as repetitive taps or flicks might be, doing so in quick succession will actually create a bubble smoothie inside your syringe. Be patient. Tap, wait. Tap again, only if needed. And when you're doing this, never flick up by the needle itself. Only flick down the barrel of your syringe, well away from the hub of that syringe. Some people have much better luck flicking with a pen or a marker rather than their fingers, but this is personal preference. Once the air bubble is at the hub end of your syringe, use the plunger to push all the air out of the syringe and needle until you see a tiny droplet of liquid exiting the bevel of the needle. Depending on what substance your syringe contains, be very careful with the drops that will come out to avoid any contamination or waste. For some substances, you may need to do this with the needle still in the vial. Once you have all the air out of your syringe and needle, reconfirm that you still have the correct volume before administering the substance to the animal. Every time a needle punctures something, it will dull a little bit, even when drawing up solutions through your rubber stopper. Dull needles cause more discomfort to the animal and/or make it harder to get the substances where you need them to be. After a few reuses, your needle can even develop burrs on it, which can lead to excess tissue trauma and animal discomfort. The best practice is to use a new needle after every piercing when feasible. If you are drawing up multiple doses from the same vial, you may want to use a single needle to pierce the rubber stopper and then attach syringes serially to that needle without removing the needle from the vial. Put a clean, unused needle onto each syringe after you fill up your syringe. A quick note, if you swap out needles after filling your syringe, remember your new needle actually is full of air. After you get your new needle attached to that full syringe, again, you're going to have to go through that bubble clearing process to clear the air from inside the needle. Point the needle upward and very gently push on the plunger until a single drop of fluid is seen at the needle tip. This will ensure there is no air in the system before you give the injection. So that's it for the mechanics of needle and syringe use. But this is something that takes practice, so don't be too hard on yourself. There are a few tips you can use to make yourself more likely to succeed. First, get comfortable handling syringes and plungers. Experienced users can do this smoothly with one hand. Practice using a syringe without a needle attached while you watch TV or sit in another lecture. There is a lot to be said for muscle memory and hand strength. You may want to work on hand strength, especially if you're going to be doing a lot of these procedures in succession. It seems silly, but you will get sore after doing dozens of these injections one after another. And tired hands don't give smooth injections. In addition to practicing the movement with unloaded syringes, tools such as finger bands and grip strengtheners are a great way to improve hand strength and dexterity. Set up your space ahead of time. Make sure you have what you need readily available, but don't overcrowd the space. Get comfortable. Think about table height or use an adjustable chair or stool when you're seated. Make sure your lighting is good. Don't hunch over the table. Ensure you're wearing proper glove sizes and non-restricting clothes and PPE when possible. In general, don't support your body weight leaning on your own arms. But do use surfaces to support your arms and hands. Use the table or a prop of some sort to stabilize your working hand. Don't let your arm sort of float above the animal when you're trying to give an injection. This will really help to hold the syringe more steadily. You can use any clean item to support your arm, a cage top, a plastic container, or even your own body in a pinch. One of the trainers taught me the phrase, tucked and braced, which is a good, concise way to describe it. Keep your arms close to your body and support your limbs while you're doing these procedures. And I have a few other generic suggestions for you. It sounds a bit cliche, but make sure you get a good night's rest, have a good meal, and are properly hydrated. Be wary of caffeine consumption. Large amounts of caffeine can make even the most avid coffee drinker a bit shaky. Treat yourself to a video game. Studies have actually shown that they help hand-eye coordination. And try not to be nervous. Nervous hands are shaky hands. Remember, we all have to start somewhere. The more you practice, not only will you become more skilled, but more confident. Lastly, our training department is always available for additional practice, to answer additional questions, or provide additional opportunities for practice. Please don't hesitate to reach out.